Welcome to the Anoka County Supplemental Training on transitioning from the Consumer Support Grant, or CSG, to the waiver using the Consumer Directed Community Supports, or CDCS option. Many people that have received a MinChoice assessment are informed that they qualify for a waiver and the Consumer Support Grant. So what do they do next? Some people have already been receiving Consumer Support Grant services, and their case manager has encouraged them to pursue waiver services. You also may be one of them. So what is the difference between a Consumer Support Grant and the waiver services using the CDCS option? We will explore this in the supplemental training so that you can make an educated decision about which program would work better for you. In order to go on a waiver and utilize the CDCS option, the person must qualify for a waiver based on the MinChoice assessment. If the person qualifies, the ability to choose going from CSG to the waiver is not entirely the decision of the person or the legal representative. In order to go on a waiver, you and your case manager must agree that your current services or less costly services are not meeting or not going to meet your loved one's needs. The Consumer Support Grant works similarly to the waiver with the CDCS option, however the funding sources are different. Another big difference is the budget amount. A typical CSG budget is about $1,000 per month or $12,000 annually. This is due to CSG being a grant service and not a federal waiver service. Waiver budgets, on average, start anywhere from $20,000 to $50,000 per year, and a person with high medical needs may have a budget as high as around $175,000 annually. After your MinChoice assessment is completed, you should be informed of what your annual budget amount would be for the Consumer Support Grant, and your case manager can get you an estimated budget amount for the waiver if you decide to explore the CDCS route. Together with your case manager, you can determine whether a waiver is needed to meet your loved one's needs versus remaining on the Consumer Support Grant. Some typical reasons for needing a higher budget amount might be because your loved one has some physical disabilities that require a home or vehicle modification for them to access their home or community. Another reason might be because you have tried traditional medical assistance therapies like occupational therapy or physical therapy, but your loved one has not made the progress you hoped for. So you would like to try some additional alternative therapies such as music therapy, horse therapy, or some other specialized training not covered by medical assistance and are too costly for the CSG budget. Those with high staffing needs also may need a higher budget amount of the waivers. Next, let's take a closer look at the similarities and the differences between the two programs. This chart will give you a better idea of what the major differences are between the Consumer Support Grant and the Waiver CDCS option. Both programs are self-directed, meaning that you or your legal representative are responsible for choosing your services and implementing the program. As mentioned previously, the CSG budget tends to be lower than the waiver budgets. The Consumer Support Grant is actually a monthly allocation of funds, and the waiver is an annual amount. The CSG annual assessment is often shorter than the waiver annual assessment, called the MinChoice assessment. Both programs allow parents of minors to be paid, as well as spouses to be paid as staff. The difference here is that the parental income on CSG is taxed, but it is not taxed on the waiver because of the IRS Notice 2014-7. Please see this training segment for more information. Since parental income is not taxed when using the waiver CDCS option, this technically could lower your TEFRA payments if you are having to account your CSG income in calculation for your parental fee. Both programs are required to use a financial management service, or FMS. If you're currently using an FMS, you may keep your same FMS. However, note, fees for CSG may be completely different than the fees for the waiver CDCS option. The waiver has often been described as the college version of CSG. CSG has a much simpler support plan that is required to be completed and approved prior to utilizing the services. This plan tends to be about 3 to 5 pages of information. On the Waiver CDCS option, the support plan requires much more detail and requires a detailed health and safety plan. This support plan may be 20 to 25 pages. Because of these differences, most people on the Waiver CDCS option hire a support planner to write the plan. On CSG, most managing parties can write the plan themselves. There tends to be more rules and regulations on the Waiver CDCS option because there are federal statutes that apply. Another difference in case management involvement. Some people on CSG do not even qualify for a case manager. If they do have a case manager, they must meet with the case manager at least one time a year. If on a waiver, at least 2 face-to-face visits per year with your case manager is required, and we require our case managers to also check in with you at least quarterly by email, phone, or in person. And lastly, the waiver has more restrictions on what you may or may not be able to purchase. On the next slide, we'll review this further. There are several items that are not allowed on the Waiver CDCS option that may be allowed on CSG. Some of these include supplements and vitamins. Supplements such as Boost are allowed on CSG but would not be allowed on the Waiver CDCS option unless prescribed through a physician as part of an approved specialized diet. Another example is melatonin for sleep. This would be allowed on CSG but not Waiver CDCS option. Over-the-counter medications are not allowed on the waiver, but are allowed on CSG. This could be for Miralax for constipation, or diaper cream for a diaper rash for an adult. The Waiver CDCS option does not allow camp to be funded for the sole purpose of giving primary caregiver relief a break, and will only pay for registration fees of a disability-specific camp. If after examining the differences you would like to move forward with transitioning from CSG to the Waiver CDCS option, work with your case manager. Now let's talk more about this. Your case manager will help you step by step to transition to the waiver. There are things your case manager must help you with that are behind the scenes. Dates are important. Your mid-choice assessment will only be able to be used for waiver eligibility for a limited amount of time. Otherwise, the new mid-choice assessment would have to be updated. Make sure you know what your timelines are, so ask your case manager. It's important to attend an orientation for CDCS so that you understand what the differences are, what the rules are, and what expectations there are. In order to be able to start a waiver, you must be on traditional straight medical assistance as either a primary or secondary health insurance and not a managed care plan. At the point at which you decide to make the change, you must make sure that you have not overspent what your monthly amount is on CSG. Otherwise, you would need to pay back the overages or wait until the next month to make the switch. Your case manager will be able to check on this for you. Obviously, in order to begin waiver services, you must have an approved CDCS plan and have completed the necessary CDCS paperwork with your FMS. If you have any further questions, please be sure to contact your case manager. If your case manager does not know the answer to something, they will ask a supervisor or one of the CDCS coordinators. Please be patient as there is a lot to know about CDCS and it is constantly changing. This concludes our supplemental training on Consumer Support Grant to the Waiver CDCS options. Thank you.